So, welcome back. We're going to be discussing on the questions for asthma. And this is the beginning of the question. We're starting with multiple choice question. Number one, if you have gone through the lecture, this will be very easy. Please like my video, subscribe to my channel, and share with your friends. Asthma. Number one, asthma has puzzled and confused physicians from the time of which ancient physician? Avicenna, Hippocrates, Galen, Paracelsus. Number two, the word asthma comes from the Greek word meaning A. Choking, B. Panting, C. Gasping, D. Suffocation. The first answer is B. The second answer is B. Hippocrates. And the second answer is panting. The word asthma comes from the Greek word panting. Number three, according to WHO or GINA, how many people worldwide are affected by asthma? 200 million, 250 million, 334 million, 500 million. Number four, which of the following is not a suggested reason for the increasing prevalence of asthma? A. Increased air pollution, increased diagnosis, decreased urbanization, reduced childhood infection, hygiene, or hypothesis. Number three is C. Number four is C. C and C, decrease in urbanization, 334 million. So the suggested reason for increasing prevalence of asthma is what? Is not decrease in urbanization. Obviously, increased urbanization has caused it. All right. So the next question. What is the mean prevalence of asthma in West Africa? What? A 2.9%, B 5.4%, C 5.7%, D 8.1%. 6. Which type of asthma is commoner in males before puberty but changes to female preponderance during adolescence? A. Nocturnal asthma, B. Childhood onset asthma, C. Occupational asthma, D. Exercise-induced asthma. The answer to 5 is C. That of 6 is B. C, 5.7%, and B, childhood onset asthma. So the type of asthma common to males before puberty is childhood onset asthma, but changes to female preponderance during adolescence. And the main prevalence of asthma in West Africa is what? 5.7%. Number 7, what is the highest prevalence of asthma in Africa? A. North Africa, B. East Africa, C. West Africa, D. South Africa. 8. Which is not a predisposing factors for asthma? A. Allergy, B. Hereditary, C. High protein diet, D. Environmental exposure. D and C. South Africa and high protein diets. Sure, you're going well with this question and you're getting it. I'm so happy if you're getting it. So let's continue. So South Africa is the highest prevalence of asthma in Africa, and high protein diet is not a predisposing factor for asthma. Number 9, which of the following is a key inflammatory cell involved in asthma pathogenesis? A. Neutrophil, B. eosinophil, C. Red blood cell, D. Platelet. 10. Which domestic pet is most problematic for people with asthma? A. Dog, B. Birds, C. Cat, D. Rabbits. 9 is B, 10 is C. Oh, B. Eosinophil is the key inflammatory cell involved in asthma pathogenesis. And 10. C. Asthma. 10 is C. Cats is the most problematic domestic pet for people with asthma. Number 11. Which exercise is least likely to provoke exercise induced asthma? A. Running. B. Swimming. C. Jumping. D. Cycling. 12. Which allergen is an indoor allergen that contributes to asthma? A. Pollen. B. Mold. D. Diesel fumes. C. Diesel fumes. D. Ozone. You can do it. B and B. So swimming, then the next one is mold. Swimming is the least likely exercise induced exercise to cause an exercise induced asthma. Then mold is the indoor allergen that contributes to asthma. 13. Which is the major risk factor for asthma in genetically predisposed individual? A. Viral infection. B. Smoking. C. Bronchial hyperreactivity. D. High fat diet. Number 14. Which drug class is not used in asthma management? A. Beta 2 agonist. B. Corticosteroid. C. NSAID. D. Leukotriene receptor antagonist. C and C. So the major risk factor for asthma in genetically predisposed individual is what? Bronchial hyperreactivity is the major risk factor for asthma in genetically predisposed individual. And NSAID is a class of drug that is not used to manage asthma. 15. Which classification system is used to classify asthma severity? A. WHO guideline. B. GINA guideline. GINA. B. C. CDC guideline. D. ATS guideline. Tell me, this is the last question. B. GINA guideline. So let's go to the fill in the blank questions. Asthma is a common chronic disease, commoner in males before puberty but changes to dash during adolescence. We've done this before, right? I know. If you follow the lecture well and if you follow the first MCQ, you'll get this. Oh, the prevalence of asthma varies from country to country, region to region, and dash within a country. Number 3, WHO or GINA estimate that up to dash people worldwide are affected by asthma. Number 4, the highest prevalence of asthma in Africa is in dash with a prevalence rate of 8.1%. Let's go to the answer. Female preponderance. The asthma is a chronic disease, is a common chronic disease, commoner in males before puberty but changes to female preponderance during adolescence. 2 said geographical areas. The prevalence of asthma varies from country to country, regions, and geographical areas within a country. WHO or GINA estimate that up to 334 million people worldwide affected with what? Asthma. And number 4 says South Africa. The highest prevalence of asthma in Africa is in where? South Africa, with a prevalence of rate of 8.1%. Number 5. Asthma is characterized by chronic airway inflammation and variable dash. 6. One of the most problematic Six, one of the most problematic domestic pets for asthma patients is dash. 7. Exercise that is least likely to provoke exercise-induced asthma is dash. 8. A major causal factor for asthma is exposure to dash. That is respiratory airflow limitation. Asthma is characterized by chronic airway inflammation and variable respiratory airflow limitation. And what? Variable respiratory airflow limitation. Then this number 6 is cat. Cat is the most problematic domestic pet for asthma patients. And number 7 is swimming. Swimming is the least likely exercise to cause or provoke exercise-induced asthma. 8 is outdoors, mite, mold, and animal dander. They are major causal factor for asthma when exposed to them. Number 9, you're following, right? Good. Let's continue. Number 9, the hygiene hypothesis suggests that reduced dash may increase the risk of asthma. 10. One of the cardinal symptoms of asthma is dash. 11. Airway inflammation in asthma involve inflammatory cells such as dash. 12. Asthma mortality is higher in dash. Let's go to 9. Childhood infection. The hygiene hypothesis suggested that reduced childhood infection may increase the risk of asthma. 10 is wheeze. One of the cardinal symptoms for asthma is what? Wheezing. 11 is T helper 2 lymphocyte, eosinophil, and mast cell. They are the airway inflammation in asthma. The inflammatory cells are T helper 2 lymphocytes, eosinophils, and mast cell. Their airway inflammation in asthma involve inflammatory cells such as what? You know it. So 12 is developing countries. Asthma mortality is higher in what? Developing countries. Beta 2, number 13, beta 2 agonists are used as dash in asthma treatment. 14. A significant indicator of asthma reversibility in spirometry is FEV1 improvement of more than dash. 15. The stepwise approach to asthma management includes short-acting dash as needed in step 1. A is number 13 is bronchodilator. Beta 2 agonists are used as what? Bronchodilator in asthma treatment. 14 is 15%. A significant indicator of asthma reversibility in spirometry is FEV1 improvement of more than 15%. Beta agonist. The stepwise approach to asthma management includes short-acting beta agonist as needed in step 1. The next question, clinical questions. 1. A 10-year-old child presents with nocturnal wheezing, shortness of breath, and chest tightness. What is the most likely diagnosis? A patient, number 2, a patient experiences difficulty breathing and wheezing after exposure to house dust. What is the likely trigger? Number 3, a 35-year-old man has intermittent wheezing and shortness of breath triggered by exercise. What type of asthma does he have? 4. A woman working in a factory developed asthma symptom after exposure to chemical. What type of asthma does she have? Ah, I'm so sorry that I went forward more than this question. So let's go over it. So we've done the first one. The first answer is asthma, right? A 10-year-old child presents with nocturnal wheezing, shortness of breath, chest tightness. The most likely diagnosis is what? Asthma. 2 is indoor allergen, house dust or mites. A patient that experiences difficulty breathing and wheezing after exposure to house dust or mites. The trigger factor is what? Indoor allergen. 3 is exercise-induced asthma. A 35-year-old man that has an intermittent wheezing and shortness of breath triggered by exercise. The type of asthma he has is what? Exercise-induced asthma. 4 is occupational asthma. A woman working in a factory that developed asthma symptoms after exposure to chemical. Type of asthma is what? Occupational asthma. Number 5. A patient with asthma has worsening symptoms at night. What possible causes might contribute to this? 6. Don't say we have looked at the answer before. Please wait and answer this question before we go to the answer. Alright, let's go ahead. 6. A 45-year-old woman presents with chronic cough but no wheezing. What variant of asthma might she have? 7. A patient with asthma presenting with difficulty speaking full sentence, respiratory rate greater than 25 cycles per minute, tachycardia greater than 110 per minute. What is the most likely diagnosis? A patient presents with asthma symptom and has nasal polyp. What type of asthma might they have? 5 is increased vagal tone, decreased cortisol, exposure to allergy in the bedroom. Because the patient has worsening symptom in the night, right? This is number 5 question. And the possible cause or contributing factor to it is what? Increase in the vagal tone, decrease in the cortisol, and exposure to allergens in the bedroom. Then 6, the cough variant asthma. The 45-year-old woman that presents with cough but no wheezing. The variant of asthma she might have is what? The cough variant asthma. The 45-year-old woman that presented with cough but no wheezing is having what? A cough variant asthma. 7 is acute severe asthma. We can see the full clinical symptom. The patient with asthma that presents with difficulty speaking full sentence, respiratory rate greater than 25 cycles per minute, tachycardia greater than 110 beats per minute. The likely diagnosis is what? The likely diagnosis is what? Acute severe asthma. And a patient presenting with asthma symptom that has a nasal polyp. And the type of asthma the person might have is what? Aspirin sensitive. Aspirin sensitive asthma. You understand? Okay, number 9. A patient with severe asthma that suddenly deteriorates despite good previous control. What type of asthma might be this? 10. A young boy has recurrent wheezing episode that disappears spontaneously. What does this suggest? 11. A patient with a patient, excuse me, a patient with asthma experience worsening symptom after NSAID use. What's the likely underlying mechanism? 12. A patient presents with acute asthma exacerbation and cyanosis. What is the appropriate emergency treatment? Let's go to 9. Don't say you've seen the answer before and you not do it though. Okay, breathing asthma type 2 is the patient that has severe asthma that suddenly deteriorates despite good previous control. The type of the asthma the person has is what? Brittle asthma type 2. Then 10 is childhood onset asthma. The young boy that has recurrent wheezing episode that disappears spontaneously suggests that the patient has what? Childhood onset asthma. Then 11 is aspirin-induced asthma. For the patient with asthma experience worsening symptom after NSAID, it's likely the mechanism underlying it is what? Aspirin-induced asthma. So we've done this aspirin-induced asthma twice. One is a patient that has a nasal polyp symptoms, and asthma symptom also has nasal polyp. Type of asthma the person is having is. Then aspirin sensitive asthma. Aspirin sensitive asthma. So is the last one. The patient that presents no aspirin induced. Then the 12 is oxygen nebulized salbutamol and corticosteroid. So the patients that present with acute asthma exacerbation and cyanosis, the appropriate emergency treatment is what? Give the patient oxygen. Give the patient nebulized salbutamol 2.5 to 5 milligram and inhaled corticosteroid, or is it IV or oral corticosteroid 40 to 60 milligram. 13. A patient is diagnosed with severe persistent asthma. What step of BTS classification does this correspond to? 14. A 28-year-old man has controlled asthma despite using high-dose inhaled corticosteroid. As uncontrolled asthma despite using high-dose inhaled corticosteroid and long-acting beta 2 agonist. What additional treatment might help? 15. A patient experiences frequent asthma exacerbation requiring hospital visits. What treatment goal should be prioritized? The number 13 is step 4. Step 4. The patient is diagnosed with severe persistent asthma. The step for the BTS classification that it corresponds to is what? Step 4. Severe persistent asthma is step 4. Then the next one is monoclonal anti-immunoglobulin therapy, or omalizumab. 28-year-old man that has uncontrolled asthma despite using high-dose inhaled corticosteroid and long-acting beta-2 agonist. Additional treatment is what? Omalizumab, a monoclonal anti-immunoglobulin E therapy. Then 15 is prevents recurrent exacerbation and long-term control. A patient that experiences frequent asthma exacerbation require hospital visit. The treatment goal that is prioritized is what? To prevent recurrent exacerbation and to optimize what? Long-term control. So let's discuss the theory question. Let's talk about theory question. Just answer this one before we go to the answer. Discuss the risk factors for asthma. 2. You can pause this video if you wish. Number 2. Explain the inflammatory process in asthma. 3. Describe the classification of asthma severity. 4. Outline the pharmacological management of asthma. 5. What are the goals of asthma treatment? So let's go to number 1 answer. The risk factor for asthma is it could include genetic predisposition, allergen, air pollution, viral infection, smoking, and obesity. Number 2 says the inflammatory process asthma. Explain the inflammatory process in asthma. Inflammatory process asthma involve eosinophil, mast cell, and T helper 2 cytokine, leading to what? Bronchoconstriction, mucus secretion, and airway remodeling. Number 3 says describe the classification of asthma severity. They are classified into intermittent, mild intermittent, mild persistent, moderate persistent, severe persistent, based on the symptoms and what? Lung function. Number 4 says outline the pharmacological management of asthma. This include beta agonist, corticosteroid, leukotriene receptor antagonist, and monoclonal antibodies. The 5 is what is the goal for asthma treatment, and this is to prevent the symptom, to maintain normal lung function, to avoid exacerbation, and minimize medication side effects. We've come to the end of this video. Please like my video, subscribe to my channel, share with your friends, and see you in the next video. Thank you so much for watching to the end. I appreciate you.